Everybody, attention up front. Hi, over at this table, we're about to get started on our panel. Alicia, this table over here, we're about to get started on our panel session. I'll wait for everybody to get settled so we can give our full attention to our delegates for the presentation that we have going on. So today we're going to be having a panel discussion about climate and health. We're going to be talking about the intersections of climate change and how that relates to mental and physical health for young people in the Caribbean, but the Caribbean at large, and basically trying to figure out how we can use education, public awareness, policy, and resources to make sure that we're able to combat these challenges. So we have some great speakers up here that we'll let give their presentations, and then we'll have time to ask them questions afterwards. But David Johnson, if you are there, can we test?
Hi, yeah, I'm here. Can you hear me?
Hi, yes. Would you like to introduce yourself?
Wonderful. Well, it's a pleasure to be here. Good afternoon, everyone. My name is David. I'm the president and founder of LetsUnpackIt. I am a medical student actively, but I'm also a very passionate mental health advocate. Very happy to be here today.
Thank you. So do you have a presentation prepared or? Okay, great. I think you can jump right into it. We're excited and paying attention. Great. And David's from Barbados representing.
Awesome. You can let me know if you can see the presentation on your end.
We'll give our tech team a minute. Is there a presentation? Great.
Sorry, are you seeing from your end?
Yes, perfect.
Okay, one moment. Okay. All right. Sorry, it's freezing on my end. One moment. Okay, perfect. Just let me know if you're seeing from your end and I'll just go ahead.
We can see your presentation.
Okay, perfect. All right, so like I said, my name is David. I'm the president and founder at LetsUnpackIt. And what I'd like to present for you today is really a short synopsis on the connection between climate and mental health, and of course, call you to take some key actions as it relates to interventions, yes?
Yes.
By the end of the presentation, I'm hoping that I can convince you of a couple of things and really have you develop a better appreciation in terms of the determinants of mental health and well-being, the connections between climate and mental health, and of course, the key actions that I'd hope we'd all want to take. And I thought at this moment, it will probably be a good idea to just give you a quick definition of what mental health is. I think so often we use that term very loosely. And so just in a comprehensive sense, the definition from the World Health Organization really is a state of well-being in which a person realizes their potential, they can cope with the normal stresses of life, they can learn and work well, they can maintain healthy relationships, and they're also able to make positive contributions to their community. And I thought I'd break this down for you in terms of realizing their potential. That speaks really to one's relationship with themselves, yes? In terms of coping with the normal stresses of life, we're talking about key things like resilience, emotional regulation, and coping strategies. In terms of learning and working well, that speaks to cognitive function. And of course, there's a role in terms of relationship with others and the idea of social inclusion and social capital. And I think if we start reflecting on what are some of the other contributors and what mental health is and what it isn't, you can kind of appreciate that, one, it's an integral component of health and well-being. In fact, the WHO Constitution contemplates that when it speaks to, health being a state of complete physical, mental, and social well-being. And that has implications for us in terms of when we're talking about policies and strategies, approaching them from a comprehensive and holistic perspective. But of course, just coming off the heels of World Mental Health Day and the emphasis being on mental health as a human right, I thought I'd just remind everyone gathered here that, we all have a right to the enjoyment of the highest attainable standard of health, that, of course, meaning physical, mental, and social well-being, as one of our fundamental rights. Yeah. And just one more point off this slide that I'd want to flag is that mental health is not the mere absence of mental illness or mental health conditions. And so in our brief discussion today, I want you to appreciate that when I speak of mental health, I'm talking about the full spectrum, not just illness, but everything in between. Yeah. So onto the next slide, I wanted to show you some of the determinants and contributors towards mental health and well-being. And we can start to appreciate here the real impact that climate change and the climate crisis in general can have on mental health and well-being. So there are a variety of contributors in terms of individual factors, social factors, and structural determinants that can combine to either boost or undermine one's mental health and well-being. And as it relates to individual psychological, environmental, and biological factors, we know based on research that exposure to those kind of challenges as it relates to socioeconomic disadvantages in terms of poverty, violence, inequality, unemployment, and other forms of deprivation are closely linked with a higher prevalence of mental illness. And I want to flag here that environmental degradation is one of those key factors that can also increase a person's vulnerability and risk as it relates to the development of mental illness and poor mental health outcomes. And of course, while all of these risks can manifest at different stages of life, we know that where these risks, have an impact as it relates to particularly developmentally sensitive periods in terms of, that transition between childhood and adolescence, between secondary school and university life, or university and the world of work, for instance.
David, are you still there? Is his Wi-Fi? Okay. David, can you hear us? Do you want to try leaving and coming back in? Okay, great. Thank you. His presentation mode? Okay. Is he still in there? David, can you also please put your presentation in presentation mode when you get back? Thank you.
All righty. Not sure what just happened, but I'm back. Can you hear me?
Yes, we can hear you.
So sorry about that.
No problem.
Let's see if I can resume sharing. I guess this is a testament to resilience as well. Yes, these things happen and we have to bounce back. Okay. Okay, are you seeing the slide?
Yes. Can you put it in
Okay.
presentation mode, please, so we
Sure,
can see it a little
sure.
bigger?
One moment. Yeah.
Thank you.
Yeah, it's not letting me do it for some reason. But I'll just
Can you
go
adjust
ahead
the
here
size
just to
of
save time.
Okay.
Yeah, number of technical difficulties. Nevertheless, what's important on that particular slide that was circled, the idea that climate in itself, the environmental degradation, also has a linkage as it relates to being a risk factor for mental illness. Thanks for everyone, for the person who's sharing. Um, yeah, so the climate crisis in itself, pollution, environmental degradation, conflict and forced displacement in itself can be a risk factor for that kind of development of mental illness, mental health challenges as well. And we can see that there's a link there as it relates to trauma and distress. Yeah. And I think we can all appreciate that the climate crisis in itself is a threat multiplier. I've listed a couple of points here, and I guess everyone could probably take a quick picture of this. But these are the kind of like general kind of points as it relates to climate crisis and the general impacts. But as it relates to the direct and indirect effects of the climate crisis on mental health and well-being, the direct effects that I want us to appreciate, everyone who's exposed to any form of conflict, any form of disaster will inevitably experience some form of acute psychological distress. And whether or not we can intervene very early in terms of what is known as psychological first aid can dictate whether or not that becomes amplified into some form of mental illness or disorder as well. Of course, there are long-term mental health implications in terms of PTSD, depression, anxiety. And we can, of course, consider the impacts as it relates to forced migration and social degradation. The fact that people are displaced from their homes, there can be the development of what is known as solastalgia, the idea that you can't really find solace in a familiar environment. And so we can see how that can literally isolate people and remove them from what situations made them feel comfortable and what made them feel well. But of course, there can also be increased vulnerability amongst people with pre-existing mental health conditions. And this is, of course, why on the next slide, I'll speak to what are some of the key actions that we can take. But I also want you to appreciate that this generation has so much on their plate in terms of the number of crises that are happening globally. And so it would come as no surprise that there's a development of what is known as ecological grief as well as eco anxiety and the feelings of hopelessness that can develop around that, not to mention, of course, or not to forget, rather, the knock-on socioeconomic effects as it relates to poverty, as it relates to job loss, having to literally choose a completely different career path on account of the ever-changing climate, literally, but also the climate as it relates to the working environment. And I also want to flag here that there is a disproportionate distribution of these effects, such that women, children, and those living in poverty in particular are most exposed to the impacts of the climate crisis, as well as the general mental health impacts. And so just coming to the end here, the question then becomes, what can we do about it? And I think there are about 5 key actions that we can all take as it relates to ensuring that we prioritize mental health and learn to manage the impacts that can be felt as it relates to mental health and well-being. So, of course, there is a role for all of us as it relates to mental health literacy and psychoeducation. Of course, we can all become advocates in that sense in creating spaces for these kind of conversations and making sure that we're building that sense of resiliency amongst young people in general who are predominantly impacted by things like eco-anxiety and ecological grief, as I mentioned. But of course, it's really up to us to make that kind of case for investment in mental health uh, programs, initiatives, etc., but also calling for the integration, and I'm talking about cross integration here, as it relates to mental health and psychosocial support within our climate action policies and programs, and vice versa as well. And then one final action would be to integrate mental health and psychosocial support into our disaster risk reduction paradigm. So I'm thinking, for instance, that we really ought to have representation from our clinicians and our mental health and psychosocial support workers on our disaster and emergency management committees, for instance, whether that is at an institutional level or it is rising to the level of our agencies like SEDEMA and our local disaster emergency management agencies as well. I think the role of mental health and psychosocial support cannot be understated there. I would note that SEDEMA has recently piloted a MHPSS toolkit that really gives advice to varying organizations on how they can all take up a role in terms of enacting MHPSS interventions as well. So I'd encourage everyone to have a read of that particular toolkit. And of course, it would be remiss of me if I didn't give everybody an opportunity to connect in terms of resources. We've created at LetsUnpackIt a resource that highlights some of the hotlines across the Eastern Caribbean. So if you could pull out your phones and scan that, that would also be very helpful, I think, to circulate amongst yourself and amongst your sphere and within your organizations as well. And then, of course, I'd love to invite all of you to join with us at LetsUnpackIt in helping not only to develop this psychoeducation across the Caribbean, but also taken up your role as it relates to advocacy on matters of mental health and wellness. So I hope that gave you a general idea of the connections and some key steps that we can also take as young leaders. So thanks so much for listening.
Thank you, David. Thank you for that presentation. Does anybody have any questions about mental health and climate change? Go ahead.
Thank you so much for your presentation. Are there any institutions that you're finding that do the mental health literacy well, that are actually, are there any models in the region that we can follow as to how people are using this? Specifically in the university context, I'd be interested in knowing what people are doing.
Yeah, that's a great question. I think there has been some work in terms of working alongside UNICEF and PAHO. PAHO has developed a mental health first aid toolkit. I know right now in Barbados, there's a partnership between PAHO and the Barbados Association of Psychiatrists in which they're training or ramping up training as it relates to mental health first aid. I know online, there is the Coursera tool in which Johns Hopkins offers a psychological first aid course. What I'd love to see being done is for more organizations to be facilitating that kind of training for their members. Of course, there is UNICEF's tool that was specifically targeted at primary school teachers. And I think more interventions now need to be targeted at our secondary and university students. I think we can all appreciate that within the Caribbean region, the non-governmental organizations and civil society organizations have been taking lead as it relates to psychoeducation. The question now is, how do we actually integrate this within our curricula across the board to ensure that more young people can have access to these tools and to build their resilience and their literacy around a topic such as mental health and well-being.
Great. Thank you. I have another question as well. I was wondering are there any cultural or societal factors that you think are unique to the Caribbean that influence the way that mental health is perceived within the context of climate change? And then how can those factors be effectively addressed when we're thinking about access to resources and outreach efforts in communities?
Yeah, definitely. I would think that the number one challenge that we face in the Caribbean is a very difficult relationship as it relates to strength. I think influenced by our historical experience and the trauma that has been passed on from that, we tend not really to have these kind of open, honest conversations. I think, fortunately, amongst young people, we're challenging that norm, and so I think there is a natural development then for having these kind of safe spaces and open, honest conversations. But of course, we have to appreciate that stigma, for the greater part, falls along intergenerational boundaries. And so we have to find unique ways in which to facilitate these intergenerational conversations. I think that the community center needs to become that kind of hub of activity where we have these conversations and where we can also begin that kind of signposting so that we see, look, these are, the signs, and I am seeing this within my neighbors. Here's what we can do to help solve that, whether it's peer support, whether it is access to community-based mental health services, whether it is referral to 24/7 crisis hotlines, or whether it's more, clinical interventions that are necessary. But I think it all comes back to that concept of realizing that strength is really not the ability to bear all, but the ability to tap into your support systems. And as a community, we can help to carry that load together, realizing that at any given time, we can all be impacted by mental health concerns. So, yeah.
Absolutely. Thank you. I just have one more question for you. What do you think is the role, especially as we're thinking about youth-led movements as well? How do you think that technology and digital platforms can be leveraged to disseminate more information and resources as it relates to mental health, especially considering, one, the potential barriers that there might be to technology access and literacy, but two, the role of Gen Z and internet in having public education platforms?
Yeah, I think fortunately I've had some experience in that field over the course of the 3 years, and I think one can look to LetsUnpackIt as an example of best practice utilization of digital advocacy. And so what we've sought to do through using Instagram and a variety of other social media platforms is to, one, educate young people about what mental health is and the resources that are available. To provide that level of connection for them in terms of an easy way to access these resources. We've noticed that throughout the Caribbean, it has been very hard for young people to connect or really understand what services are available. And so we've been very busy in terms of creating the directories and so on, and working in addition now with UNICEF and Healthy Caribbean Coalition to create a region-wide mental health and psychosocial support services directory for the Eastern Caribbean. Beyond that, we've also been trying to empower young people to appreciate that mental health is their right, and in taking small meaningful actions, they can actually advocate for greater resources and access through online means, but also on the ground. And the question that you've proffered about that kind of technological divide is a critical concern for us. And so what I would advise young leaders is not to just use social media and technology as that crutch. Use it as a way to amplify your message, but also remember that you need to be reaching young people where they are. And so I think, again, the school environment is a great way to reach young people. Access in terms of the community centers as well, going to the pavilions within the communities. That's a great way to actually start networking and connecting young people. And I think the role of us as of advocates across the region now has to be not only in terms of building awareness, but building that momentum behind actually getting on the ground and calling for the change that we want to see, and realizing that we also have that level of voting power, going to the ballot and making sure that these issues are also represented on the ballot. I would say these are the key ways that we need to intervene. Yeah.
Thank you for that, David. You got a lot of snaps from the room. That was really empowering. We have one more question from the crowd. Introduce yourself and say where you're from.
Okay. Good afternoon again. My name is Abigail Ellis, and I reside in Grenada. I'm from Grenada. I'm happy he provided clarity on not only using technology as a crutch, primarily because I feel like we would have been leaving out a very huge population of young people who don't have access to technology. I think we should not be ignorant that, yes, we live in an age of technology, but we have a lot of people in the Caribbean who can't simply afford a cell phone, whereas your family probably might have iPhone as a phone. I know in Grenada, a simple device as a tablet which was used during COVID for the children to participate in online schooling. That showed us that it created a huge challenge because a lot of people couldn't afford it. They're impoverished to begin with. So technology is not at the top of their list of getting. So thanks for clarifying that, because I always believe that the traditional methods, how we started, the face-to-face interaction, like now we're seeing how technology provided a challenge for us to get through these sessions today. So just imagine how we're trying to use said technology, right, to address certain issues. I think it's showing us that face-to-face can be much more effective. Now, David, I know you made mention of eco-anxiety and something like that in your slide. I saw that there. Are we looking at ecotherapy as an anti to that and other nature-based intervention? Because I do know that, yes, we're going through climate change and etc., but I think we should always try to look for the positive and how we can reverse that. In psychology, I'm not sure what it's called because that's not my field, but I do think we need to look into ecotherapy and nature-based interventions as we try to combat mental health and climate change. So my question to you is, excluding all the narration, my question to you is, what are some of the barriers that your group and other groups have been facing as you try to spread your message on mental health and climate change? What are some of the barriers you believe that our government system and other policymakers should remove to make it much more easier so that we can penetrate the system and be more effective in our cause? Thank you.
Excellent points, and I'll try to hit on everything you mentioned. First of all, Grenada is my second home, so I'm happy to see that you're represented there. Grenada is one of the most beautiful Caribbean islands, and I think it would be a best practice if we can have that kind of ecotherapy starting there in Grenada. Definitely, there is a precedent for this. Here in the UK and certainly in Canada, there have been excellent examples of general practitioners actually prescribing exposure to nature and actually getting out into the environment as a means of coping with stress and coping with certain mental health challenges. So I think that is definitely something that we can capitalize on within the Caribbean. I've been in spaces where we're now discussing promoting the Caribbean as a rehabilitative zone. And so the idea that we can actually take advantage in terms of offering that as a tourism product, the idea that people should be coming to the Caribbean for a respite and that kind of mental health rehabilitation, even in terms of building new psychiatric facilities and mental health rehab centers. Considering what these facilities look like, where we're putting them, whether we're putting them in botanical gardens, whether we're putting them alongside the ocean, and the therapeutic effects that those can also have. I also want to raise the point you mentioned about technology. I think this is a great place also to call for corporate social responsibility. The idea that our network and communications sector can also play a role. I've noticed that one particular telecommunications agency has been rolling out initiatives within Grenada and a neighboring CARICOM island as well that looks at expanding access to the internet and technology. I think that's a really good initiative that should be rolled out across the entire Caribbean. On the latter point that you proffered as it relates to what challenges we've been facing, I think financing is one of those key challenges that we face. Mental health traditionally within our region is averaging at less than 4% of the healthcare budget in most Caribbean islands, which is simply insufficient. And like I mentioned, NGOs and CSOs are really carrying the load as it relates to psychoeducation and particularly advocacy, and even in some territories, providing the actual community-based mental health services. So the fact that they are not receiving the level of investment that is necessary is a particular challenge. But I think for us as a youth-led, youth-focused group, one of the key challenges that we're facing as it relates to partnering with governments is that they don't really understand mental health from a preventative standpoint. They're still very much laser focused on intervention. And so the work that we have to do has to be to roll back that concept and really get them to be in that space where they can be launching the programs that actually, are focused on developing those kind of positive coping strategies in advance, and also early signposting. Something as simple as having a published resource of services is very simple because governments and ministries have access to this data. It's just a matter of publishing and making sure it is connected with young people. And I think just wrapping up this point, the second thing is also realizing that youth inclusion has to go beyond coming to us 1 week before an event and asking our take on it. We need to be included from the planning and designing phase all the way up to monitoring and evaluation. If we can get that done, I believe that we can reach young people where they're at and ensure that we connect them with the resources that they actually want and need. So I really hope that gave a comprehensive response to your questions.
Wonderful. Thank you, David. Everybody, round of applause for David and that presentation. Thank you very much. That was very thorough and very important as an intersection of climate change. We have one more presenter. Renae, are you there?
Hi, yes, I'm there. Can you hear me?
Yes, we can. Grenada in the house. Hi.
Hi.
Okay, do you want to introduce yourself?
Hi, so good evening to everyone. My name is Renae Baptiste. I'm from Grenada. I am a foreign diplomat based in New York. My background is public health, and I've been working in climate adaptation for the past maybe 5 years or more.
Wonderful, thank you. Do you have a presentation to share?
Yes, so let me see if I could share screen right now. Share. Presentation mode. Okay, can everybody see the screen?
Yes, we can.
Okay, so good evening again. So I'm going to speak on climate change and health, in particular, looking at public health. So we'd first look at an overview of climate change, look at some of the effects of climate change, the reality here in the Caribbean, some of the implications, risk, and challenges that we're facing right now in terms of public health due to climate change. So climate change, we can define as a long-term shift in the planet's weather patterns, which is attributed to increasing emissions in global greenhouse gases, which is a byproduct of carbon dioxide produced from burning of fossil fuels, such as oil and coal. Now, we know that this excessive greenhouse gas becomes trapped around the Earth's atmosphere, and this is what causes the phenomenon that we know called global warming, which essentially is what is causing the change to the Earth's climate. So over the past 15 to 20 years, there have been growing concerns about the impacts of climate change on the environment, health, and food security in the Caribbean and the whole world. And this has resulted in discussions at various levels, international summits, and high-level meetings. In 2015, we were able to, countries committed to the Paris Agreement of Climate Change, which was post the Kyoto Protocol. And within this Paris Agreement, it was the first time that adaptation was placed on the policy agenda, and the first time that adaptation was basically on the same level as mitigation. So before, we always talked about mitigating effects, but we never looked at in terms of how do we adapt to that reality that's happening. There's only so much that we could do in terms of mitigating, but climate change and its effects that are happening to us right now, we need to understand or find ways to cope and adapt to it. So climate change in the Caribbean is already affecting our public health, and will continue to do so in the future. It impacts our social and environmental situations, determinants of health, such as our sufficient and safe ability to have sufficient and safe food, safe drinking water, clean air, and even shelter. Some of these indicators that we use to identify climate change would include the rise in our average temperature over both land and sea, rainfall, decrease in the Arctic sea ice caps and melting glaciers, rises in our sea level, and increases in humidity. So if we look at the effects of climate change can directly and indirectly cause natural disasters such as droughts, floods, or extreme weather conditions, such as hurricanes. And if we look at the recent times, we've had extreme heat. And extreme heat is the largest global threat thus far that we are already seeing within the region. Climate change can also result in changing landscapes and wildlife habitats because changes in just 1 degree Fahrenheit can alter the balances of our ecosystems and adversely impact plant life. The Caribbean region, as we know, is made up of small island developing states. And we are the most vulnerable to the negative impacts of climate change. And on top of that, there's a lot of disproportionate consequences. Industrial countries, large developing countries, they contribute the largest percentage towards the global greenhouse gases, but they don't feel the effects that we feel. In the Caribbean region, we contribute less than 1% to the greenhouse gas, but we particularly feel the vulnerable effects and the effects of what these bigger countries are doing. If we go on to look at some of the implications and risks, the risk and challenges associated with climate change and public health, they can be both direct and indirect. In the recent years, the regions had experienced more frequent and intense storms and hurricanes. We've had rising sea levels, loss of our coastal areas, coastal zones. We've had to implement coastal zone management. I know, especially in Grenada, we've just recently done a coastal management act, which helps us to at least manage our coastal areas. We've had prolonged periods of drought and heat waves. Now, in recent times, heat waves were not something that affected us within the region as much as it is right now. We've been affected by consecutive days of extreme heat. And going forward, it's predicted that we continue to see these things happening, and it's going to continue to affect our population. In particular, older people, older persons, elderly, they have issues in terms of their body becomes impaired with thermal regulations, and it makes it more difficult for them to regulate their body temperatures, which make them more susceptible to different stresses related to heat. Higher temperatures is also associated with air pollution. It even affects our mental health. There's stressors even for us as adults, even for young children are feeling the effects because of the heat. It makes it a little bit more difficult for them to concentrate and become productive even within our school systems. When we look at flooding, there are also indirect health risks related to flooding due to contaminations within our environment. For example, flood waters can carry a lot of pollutants and even chemicals from our farms, even wastewater and sewage water that can lead to contamination to even our drinking source of water, as well as our food sources. I know like in Grenada, as well as a lot of other Caribbean countries, we don't have a proper treatment for our sewage or fecal matter. So when we have flooding, a lot of these fecal matters run off into our lakes, our seas, and they even enter into our food chains, contaminating a lot of the things that we put into our body. There's also been increasing communicable diseases. Even more now, we see an increase in vector-borne diseases, diseases that are being transferred by mosquitoes. So we have an uprising dengue fever, malaria, yellow fever are some examples. Because these higher temperatures and seasonal variations are expanding now in areas where these diseases were not known to be prevalent, but because of these changes in our temperatures and our environment, they're now able to thrive in these environments. There's also food and waterborne diseases. You'd also notice that a lot of people now suffer from gastroenteritis. There are even airborne diseases. You'd see a lot of people now suffering from respiratory issues. Every time you turn now, people have some form of an influenza. There's an uprise in terms of the cases of tuberculosis we see now compared to before. So there are all these issues that are happening as a result, both directly and indirectly due to climate change. There are the non-communicable diseases, air pollution, which I mentioned before, respiratory issues, stress, mental health, malnutrition, which is a result of issues within our food security. temperature rises by just 2.8 degrees Celsius as an effect based on crop yield, growth, increasing growth of pests, bacteria, diseases. Even the rise in sea levels would cause salination of our water supply, which affect both our agricultural land, it affects our fisheries, um, hurricanes, and even these extreme events cause damage to our crops, even frequent drought. And one of the issues that we're having is and I'm sure most of us would notice it within our countries, that seasonal variations. Some seasons are starting earlier and lasting longer. And this is affecting in terms of the type of crops we're able to produce. Some crops thrive in different conditions. Um, and one of the things that happen now is that certain crops, when they become limited, it affects the cost or the value of it. So the value increases. There's a limited amount of food. Only certain persons who are able to pay that high price would have the availability of food, as well as would there be low productivity rates for our livestock. So in conclusion, we could say that health is being impacted by climate change. And although states have made the smallest contributions, we feel the brunt of it. We've been experiencing almost simultaneous devastating effects of climate change through hurricanes such as we could say Irma, Maria, and Harvey over the past few years. But along with that, we're being plagued with challenges such as floods, droughts, heat waves, water and food security issues within our fisheries and marine biodiversity, and uprising even vector-borne diseases, which have severely affected and continue to affect our region and health. And one thing I forgot to mention within this presentation is not only is it affecting our health, but it's having an effect on our health systems. So it becomes a little bit more difficult now for our health systems to cope as well as to respond to a lot of these diseases and a lot of these events that are happening. And as you guys would sit and discuss throughout this week, and David would have mentioned in his presentation, it's important that we continue to advocate and educate both ourselves as well as our peers, our leaders, our policymakers, because it's important that people understand or put a linkage between what is happening, what we're experiencing, the causes of it, and to ensure that going forward, we take into account our current situation, we take into account the issues that we're facing, and build that into our policies to ensure that we are building policies and building nations that are able to adapt and thrive through these growing conditions, and we're able to flourish within the current state that we're in. Thank you.
Thank you. Round of applause for Renae. Does anybody have any questions? I have one that I can start us off with. Thank you, Renae, for that presentation. That was very thorough. And it's great to outline all of the different ways that climate change intersects with our health, because there's so many different facets of our society that it's interwoven with. And I want to pick up on what you were talking about at the end with policies to mitigate these effects. And I was wondering what you think are some policies or initiatives that can be implemented from the local to the national and the regional scale to enhance the accessibility of public health resources in order to be able to tackle this crisis?
I think the first thing we could look at, what I mentioned in terms of advocacy, is education and awareness. We could look at our school curriculums. The easiest place to start is starting to have that conversation within the schools, starting with our younger generations. One of the things I learned within working with communities, with adaptation projects, is important to start with the young children, start at the schools, see how we could get that message into the schools, because these kids go back home, they tell their mothers, they tell their grandparents, and that way we build a conversation. We start the conversation from at home that would then trickle onto larger platforms. One of the things now I've started to see, especially within the region, young people know, I shouldn't say no, but are now starting to have a seat at the decision-making table. A lot more governments are being more open to having young people at the table. So if we start educating them and having them to have a better understanding in terms of what the situation is, the causes, implication, possible solutions, then when we sit at these tables, we're now able to give constructive inputs or constructive additions that into these policies to ensure that what we have on the table, what we decide on or agree on, would ensure that we are tackling these issues for a more resilient nation.
Thank you. Any other questions from the crowd? I have one more that I can ask you, and then we'll wrap up. How do you see there being a collaboration between, especially youth-led environmental organizations and healthcare institutions, in order to strengthen the response that we see in terms of these climate-induced challenges? So what's the role of young people? You kind of talked about it in terms of education and awareness, but what can we do in terms of advocacy to specifically strengthen our healthcare institutions?
Sorry, could you repeat? Like, I missed a good bit of the question. You were breaking in and out on my side.
Sure. I was asking how you think a collaboration between young people and youth-led environmental organizations, or maybe even just environmental organizations more broadly, and the healthcare sector can help to strengthen our healthcare institutions when it comes to mitigating these climate-induced challenges.
Um, Let me see. The first thing that comes to mind, I could think when I was doing my master's in public health that we did within Grenada, liaising with both health clinics, institutions, as well as environmental groups, where we went to communities. We did what we called a health drive. So it was kind of like a community day where we brought the community together. We had like offered free services for them. It was a bit of a little more education and awareness, as well as people were kind of understanding, okay, the way we feel, there's a possible sorry, how do I say this? What is happening to us in the terms of our bodies, our respiratory issues? This is the cause. These are some possible adaptation ways or measures, that things that we could do to help prevent that. So I think those type of collaborative events or things that you could do within the communities is a great way that we can merge together and get that message out there.
Absolutely. Thank you, Renae. Abigail, question? Comment?
Good afternoon again, everyone. My name is Abigail Ellis from Grenada. So in terms of, and of course, thank you, Renae, for this awesome presentation. Wood Wood Grenada. As it relates to public health and climate change, I believe that our government, our legislative bodies, our policies makers, they should be doing a lot in enforcing a lot of the laws that we have when it comes to that. Let me explain. Now, we live in an era where someone can decide, I'm going to build a house here. They build it anyhow. There's no standard to it. You're not building it with the fact that you're living within a hurricane belt in mind. You're just putting two pieces of board together and deciding that I'm going to call this home. There are laws governing how you build certain structures in countries, but who's enforcing these laws? Too many times you walk around Grenada, and I'm pretty sure Renae could attest to that, and there are so many homes that are built so closely to each other, they can't even accommodate a toilet, indoor toilet facility. Currently, Nation Builders in Grenada, we recently launched a program called WASH. It's water, access, and sanitation in homes. Primarily because there's so many communities with pit latrines today in Grenada. And I'm not talking about 5 homes, I'm talking about thousands of homes in Grenada. And we're talking about health, climate change, and all these things. Now, when that heat from the sun hits that pit latrine, you can imagine the stench. Now imagine somebody having to live daily, breathe this in daily, what it's going to do to their health, of course, a few years down the road. Now, before we could have gotten to that point, the policymakers should have said, you're building a house here, do you have any plans to put indoor facilities in place? You're building so close to this person, would you be able to accommodate certain, do you understand where I'm going with this conversation? So there are laws in place, but who's enforcing them? When we're building our drains and roads in Grenada, and I'm not just, I could speak to Grenada because I work for the government, but when we build drains and roads and all these things and we talk about flooding, it's governments that are building the drains and roads. It's not people that's going to pick up cement and blocks and build it on their own. And again, so who's enforcing it? Who's saying that there needs to be a standard and we're going to build according to the standard, we're going to live according to the standard, we're going to implement and enforce? Nobody's doing it. And then after, We come and we say, well, climate change is affecting this. The climate did not do that to herself. It was our actions, our behaviors, our lack of knowledge, and people in higher society and with authority failing to do what they have to do from a higher level. So now we get to this point, and now we're talking about prevention, right? And so when it comes to public health and climate change, we really need to look at the root issues. Our policymakers, and we were asking earlier on who's not here? They're not here. We're here. And hopefully we bring this message back to our countries and we send a very strong message across the board that if you're doing what you need to do and I do what I'm doing, together we can be a force to be reckoned with. But if I'm doing this in isolation and you're not listening to me, you're not supporting me, you're not collaborating with me, guess what? 50 generations from now, another environmental group would be formed doing the same thing over and over, and we're going to be in cycles continuously. And so my contribution to this conversation is that we need to start with those whose hands the authority lies in. Our governments, our policymakers, our advisors to prime ministers, etc., our heads of NGOs and heads of youth-led organizations, etc., and send a very strong message. Everything else is secondary, but we need action to combat climate change now, and educational awareness is going to take some time. So we need something that can be effective as in the morning. What can do that? Laws and policies. Thank you.
Thank you for that, Abigail. I don't know if I could just add a piece to what you said. It is true in terms of the enforcement of these laws, but I think it's also important that we bear in mind that we have to revise a lot of these policies and laws that are in place. Because I could speak for Grenada in terms of there's a lot of these policies that would have been done years gone by before we were in the situation we are now. So I think in terms of like even you mentioned about constructions of drains, roads. I think we now have to at least revise or sit and try to see what those policies we had in place 10 years, 15 years ago, are those procedures, are those policies still relevant to meeting the needs that we have today? So yes, we need to continue enforcing, but I think we also need to have that conversation in terms of are they relevant in our current time? So I just wanted to add that part as well.
Absolutely. Okay, round of applause. We're going to wrap up the panel here. But thank you to Renae and thank you to David. That was a wonderful session. And I'm really happy that we got a mix of both the public health and the physical health sphere and mental health. I think it's important to think about both of those in tandem and especially to think about them within the context of climate change. So thank you for coming. And that's it for this panel. Thank you, everybody. One more round of applause. Great. Thank you, too. Nikita, that wraps us up for today. Wow. Ja?
Thank you, everyone, both here in human existence, in flesh and bone and blood, and in Zoom land, also in flesh and bone and blood. Thank you for being here and just for everything that you have brought to the table, both your patience in everything, the technology, our coordinations, logistics, but also your passion and your expertise. We have a really dynamic group. It's just been so amazing seeing all the different people join us virtually, and just the talent, the diversity, the power that we have amongst us, I think is just beautiful. And this is only day one. So I think this is a huge and tremendous start. I just want to give us a little recap of sort of what we've done today in case you forget or in case you just kind of tuned in for a part of it. We had our opening with BYCASE. BYCASE stands for Barbados Youth Climate Action Summit and Expo. So this is where we were all together in the main ballroom. We had a beautiful artistic performance in sort of like various stages, from the violin and the saxophone starting the national anthem. We had the dancers, and then we had beautiful sort of singer as well with sort of mixed media, looking at sad dying coral and then just beautiful voices. And then we moved into a really fantastic panel, a dynamic panel about with women in climate. And some of you in this room graced the stage. And it was just so beautiful to see the range of ages, experiences, and perspectives. And while she's not in this room, I just want to shout out the young lady who was the youngest person on the panel, because I think she just blew all of us away. Poverty of the mind. What I just didn't even know what to say when she dropped the poverty of the mind comment. So that was just, I think, so rich. For oxymoronic to say poverty of the mind is rich, but that comment was just a very astute reflection of where we are, I think, as society and peoples, and where we get to go, or the opportunities, the abundance that lies ahead of us. So I think that's a really great sort of note for us to leave and reflect on, is just the abundance that we can co-create with the diversity of talents that we have in this room, physically here, everyone else in Zoom land. So I'm really looking forward to what's to come tomorrow. So as we moved into our afternoon, though, we had technology. We sort of wiggled our way through technology, but we figured it out, and we love Zoom. COVID has taught us a lot, and that we trust Zoom. So Zoom will be the way of being for tomorrow as we move forward with the technology. And we then dove deep into the ocean, and we had a great panelists speaking about ocean biodiversity loss. Deep sea mining was so fascinating. I really enjoyed that. It took me to a different dimension where I haven't often spent as much time in earnest thinking about the challenges of deep sea mining, even though I know it's there and present. So I really appreciated that. And just also, I think it was really interesting for us to reflect on how the different countries. All right, y'all, do you want me to stop? There's a lot of cross communication. I'm just gonna, all right, if you can just hold it up, we're gonna wrap it up, and then we can get to networking, because we do have people online who are listening in. Okay, so then what was really interesting, though, was the reflection from the different countries and how different countries are responding differently as it relates to deep sea mining. And then also thinking Jamaica, which I don't know if we had Jamaicans online. Way too much conversation, because they're hearing you. Thank you. And as we wrap that up, what was our last? Oh, the deliberative dialogue. That was really great, and I really thank how everyone showed up for that. I think this was a really great addition to our RCOY this year that we did not have last year, because it facilitated rich conversation and discourse. So thank you for just all your perspectives. Thank you to everyone who took the time to build that document, that foundational document. As you can tell, did not just happen overnight. There was a lot of work that went into that. So Marjan, Leslie, and everyone else, thank you, thank you, thank you. It would not have been possible without your contributions. And then bringing it home, I think it's very important for us to just sort of anchor in the health realities of the climate crisis. And I know, as you probably do, COP28, the priority is going to be health and climate is one of the priority thematics. So I think it's great that we covered this on our first day. Also, mental health, so very important for all of us, and what access gets to look like, how we dismantle stigma, and then that conversation about nature and the power of nature in healing and helping us heal with our trauma was also, I think, just so poignant. So thank you. Super powerful day. A little bit of housekeeping and just logistics for those of you in the room here. Well, actually, before I do that, so let me just wrap up. So thank you, everyone, for joining us, for zooming in, staying on. Please continue to comment and carry on the conversations in the Circle platform. There's so many different people zooming in or connecting from different parts of the world, and the region. So it would be great to facilitate that ongoing discourse in the Circle community. We will resume tomorrow, So either join us virtually or in back here at the Hilton. I think we're going to be meeting at 9 o'clock. For those of us who are in the room here, just a little bit of logistics. So Zoomland, thank you very much. Wishing you a wonderful evening. Get home safe, happying, and we will see you tomorrow. For those of us in the room, just our taxis will be here at 6:30 to pick us up. We have some more DSA to give you. We will make a stop at the grocery store. You are encouraged to get provisions that you will need for the next 3 days, Wednesday, Thursday, Friday, right? So we've got 3 more days here. So whatever you need to support you in meals, this would be a good time to do that. Specifically thinking breakfast, dinner, lunch. We'll be here again. So if you wanted to go tomorrow, there will not be a lunch that we'll be able to partake in tomorrow. So either we want to bring a packed lunch, or we'll walk off site to one of the restaurants close by. Keeping in mind though, we have an hour. So if we are walking off, we got to be prompt tomorrow, because we are also holding space with our online guests. And yes, for those of you who are just arriving in, your rooms are set. We've got the